important matter in our Sharia, as we will learn A to Z of purification.
Appreciate the holistic approach of Islam in dealing with various affairs of life in A to Z series. Every Monday at 8 p.m. and repeat telecast at 8:30 a.m. UK on Peace TV.
A friendly message by Dr. Zakir. Islam prohibits killing of innocent human beings.
Every day, innocent human beings are being killed in different parts of the world. Most religions condemn the killing of innocent human beings. But Islam goes a step further and says in the glorious Quran, Surah Al-Ma'idah, chapter number 5, verse number 32, if anyone kills a human being, unless it be for murder or for spreading corruption in the land, it would be as if he has killed the whole of humankind. It does not stop here, but continues. And if anyone saved a single human life, it would be as if he has saved the life of the entire humankind. Remember, please do not kill a single innocent human being, but rather save the whole of humankind by saving human lives.
Human life is precious. Peace TV, the solution for humanity.
The value of money in the hereafter will be measured by its proper use in the present.
يا أيها الذين آمنوا أنفقوا مما رزقناكم من قبل أن يأتي يوم لا بيع فيه ولا خلة ولا شفاعة.
According to the glorious Quran, one of the best ways to use your money is to spend it in the way of Allah subhanahu wa ta'ala by spreading His message of Islam. Peace TV is a non-profit Islamic satellite television channel that is primarily dedicated for just that cause, the proper presentation of Islam. It's a great choice to invest in it and a golden opportunity to purify your wealth in a way that pleases Allah subhanahu wa ta'ala.
Support Peace TV. Send your zakat and donations to IRFI Al Ryan Bank, 47 Calthorpe Road, Birmingham, UK. B151TH. Pound account number 011-32301. IBAN GB49ARAY 30008301 132301. Sort code 300083. Swift BIC code ARAY GB22. Please confirm your contribution at support@peacetv.tv.
Support Peace TV, the solution for humanity.
The value of money in the hereafter will be measured by its proper use in the present.
يا أيها الذين آمنوا أنفقوا مما رزقناكم من قبل أن يأتي يوم لا بيع فيه ولا خلة ولا شفاعة.
According to the glorious Quran, one of the best ways to use your money is to spend it in the way of Allah subhanahu wa ta'ala by spreading His message of Islam. Peace TV is a non-profit Islamic satellite television channel that is primarily dedicated for just that cause, the proper presentation of Islam. It's a great choice to invest in it and a golden opportunity to purify your wealth in a way that pleases Allah subhanahu wa ta'ala.
Support Peace TV. Send your zakat and donations to IRFI Al Ryan Bank, 47 Calthorpe Road, Birmingham, UK. B151TH. Pound account number 011-32301. IBAN GB49ARAY 3000-8301, 132301. Sort code 300083. Swift BIC code ARAY-GB22. Please confirm your contribution at support@peacetv.tv.
Support Peace TV, the solution for humanity.
Pearls of Prophet Muhammad, peace be upon him. Abu Sa'id al-Khudri, may Allah be pleased with him, narrated that he heard the Prophet, peace be upon him, say, whoever amongst you notices something evil should correct it with his own hands, and if he is unable to do so, should prohibit the same with his tongue. If he is unable even to do this, he should at least consider it as bad in his heart. This is the lowest degree of faith. Sahih Muslim, Volume 1, Book of Faith, Chapter 21, Hadith number 79.
Scientific notions in the glorious Quran are among its endless aspects that can testify for the divine nature of this noble book. These scientific notions are probably the best addressed to the people of our time. I am Zaghlul al-Najjar. Please join me in this program to discuss some aspects of the scientific notions in the glorious Quran.
Created the universe.
Appreciate the word-to-word authenticity of scientific notions and proven facts mentioned in the glorious Quran 1400 years ago in Scientific Notions in the Glorious Quran. Every Saturday at 8 p.m. and repeat telecast at 8:30 a.m. UK on Peace TV.
Where truth is hidden, misleading quotations create confusion. Where truth is hidden, lack of knowledge and wisdom cause upheaval and commotion. Where truth is hidden, manipulated scriptures and twisted facts emerge. This very hidden truth creates false propaganda, mayhem, chaos, disorder, and turmoil in our lives and the world order. But is there anyone with courage and wisdom? What is the truth, and who has the courage to expose it? Because it's your right to know the truth.
Watch truth prevail and lies perish in Truth Exposed by Dr. Zakir Naik. Every Sunday to Friday at 9 p.m. and repeat telecast at 7:30 a.m. UK on Peace TV.
Brothers and sisters, Assalamu alaikum and welcome back. We're still talking about prostatic problems, and with us is Dr. Muhammad Hatem, consultant of neurosurgery. Dr. Muhammad, we were talking about the investigations and how would we manage somebody who has prostatic enlargement. We stopped by that you have to do a hormonal test,
PSA.
PSA.
It's called PSA.
And how important is this?
It's a simplification for prostate-specific antigen.
Yes.
It's a blood test, simple blood test, in all laboratories is present. Usually we have cut-offs for this investigation.
Mm-hmm.
Usually the patients shouldn't have PSA more than 4.
4?
4. If it is more than 4, we have to do more investigations for having cancer prostate.
Yes.
Yes.
So this is where it comes to define either this is just hypertrophy, as you said.
A benign hypertrophy,
a benign one,
or it is a malignant
or it's a
cancer.
malignant one.
Yes. Another investigation, we have to do serum creatinine for this patient.
Serum creatinine, to see how functioning how the
harmful is the residual urine for this patient.
Because of the serum creatinine is to test the function of the
function
kidneys.
of the kidneys.
Yes.
Yes. Sometimes patient is present with renal failure. And when we fix a urethral catheter, after a few days, this renal failure disappears. The kidney regains its function.
That's because of the obstruction.
Yes. That's it.
Do you have to take a biopsy from the prostate?
This is when we have an elevated PSA, or when we are doing PR and there is query nodule, suspicious nodule, something like that.
You have to take a biopsy.
You have to take a biopsy, and it's done by a transrectal ultrasound.
And it's not that painful?
Not that painful.
Not that painful?
Not that painful.
Yeah. So now that you have done most of your investigations, your situation now is just a benign hypertrophy or enlargement, or it is tumor. Of course, a tumor, you have to deal with it more aggressively than the benign situation. But let's shift to the benign side, which is more common, I believe. How would you manage this patient?
First, I would like to say there is nothing called protective surgery. Nowadays, we hear a lot of people saying, I am going to have, my doctor told me I'm going to have prostate as a protective. It's enlarged, so I have to do surgery. It's untrue. This is completely wrong. We have indications for surgery, we'll talk about it. First, we start medical treatments for all patients, even if he has retention.
Yes.
We start medical treatment. There are many types of medical treatment. Something called alpha blockers, which start on smooth muscles. Something called finasteride, which start acting, but after a bit longer time, on the fibrous part of the prostate. Then we show the improvement of medical treatment, symptoms improvement, and if there is malfunctioning of the urinary tract, is it improved or not?
Yes, but when somebody has prostatic problems, we usually hear that even if he is coming to complain about other things, he tells you, I'm on medication for the prostate for life. Is it for life?
Yes, it's for life.
So
when you start medication for life,
you don't stop it.
It's daily treatment, like treatments of hypertension or diabetes. Can you stop treatment for hypertension or diabetes?
No, you should continue with that.
It's the same for the prostate. Nothing could regress the prostate.
Medically speaking.
Medically.
Yes.
Yes, we are speaking medically. So he should note he is going to have this treatment for life. If he is accepting, so that's good.
That's good. So usually the medication gives a good result with what kind of patients?
We can predict, but some patients who have the smooth or the stromal part of the prostate enlarged, they have good outcome with medical treatment. When the fibrous part is the main enlarged, there is a little bit improvement, or sometimes no improvement with medical treatment.
So how much time do you give for the medication to say, no, this is not working, we have to shift to another solution, or yes, this is going well, we should go ahead and proceed with the medication all the time?
According to the patient, we have emergency situation, as having retention, for example. There is malfunctioning of the urinary tract. There is elevation in the serum creatinine. We should interfere. We can give trial for medical treatment. But all other patients, we have to start medical treatment. And we increase the dose of medical treatment to reach the maximal dose. If there is no improvement, the patient is still complaining. If there is no improvement for the patient, we have to interfere.
After what time of period?
About 2 weeks to 1 month. Yes.
Yeah, to 1 month. So now somebody who is not satisfied with the medication, what's the next step? You go to surgery right away, or you have something in between?
We should investigate the size of the prostate. Size of the prostate differs from one patient to another and differs in our management, surgical management.
How would you know the size?
By the ultrasound.
With the
usually,
ultrasound. Okay.
Or the transrectal ultrasound, we can use it. The patients having small prostates, up to 100 grams, we can use what's called a transurethral resection of the prostate. We can see here in this picture, this is how we enter with the cystoscope. We can see this picture.
Yes.
This is a picture showing, this is the loops of the prostate. You can see it.
On the sides?
On the sides.
And you're going through the urethra?
Through the urethra.
With a scope?
By a piece of metal.
Yes.
Called the resectoscope.
Yes.
And we start to cut through this tissue and remove all this tissue.
This does not have any effect on the urethra itself?
No.
No. Yes.
We can see the other picture. This is showing here. Here is a piece cutted from the.
Oh yes.
You can
this
see
is
it.
a resected part of the prostate.
Of the prostate.
And this makes the prostate smaller in size.
Yes, we can remove mostly whole the tissue of the prostate up to the capsule. We reach the capsule.
The outer band.
To the outer band.
So, and this does not affect the function of the prostate?
No, there is no prostate anymore.
Yes.
After we do prostatectomy, either transurethral or open prostatectomy, there is no prostate anymore.
And how does that reflect on the function of the prostate?
There is no semen coming out. The patient should notice that if he is going to have intercourse, there is no semen will go out. Most of the semen, if there is semen from the seminal vesicles also, will enter the bladder and then comes out with urine.
And of course, this would affect the fertility of this person.
Patients with more usual prostates, we use open techniques, or nowadays we use laser. There are different types of laser. We can use it to remove the prostate, and it's much more safer than what we said, the transurethral resection. There is no blood loss. And we use certain irrigants which are not harmful, don't cause what we call TUR syndrome, some complications of the operation. It's much more safer, the laser.
And you go through the urethra as well?
Still through the urethra, all through the urethra.
The same route?
Yes.
You mean the differences in the how you resect and how much you resect?
Exactly. The laser vaporizes the tissues.
Yes. Yeah.
Resection, we resect the tissues. But the laser, there is a rod, we pass it, and we vaporize the tissues.
So what are the ways to be able to treat the prostatic enlargement? Are there
we said if it's a huge prostate,
yes,
we can use the open surgery.
Yeah,
which is very rare to be used now. We usually use the advanced techniques. Well, we remove the whole prostate. Either we open the bladder and remove it through the bladder, or we open the capsule of the prostate and remove it through the capsule of the prostate. That's all.
Some of the patients who have problem of the enlargement of prostate get to have some injection in the prostate. How often is that useful?
It's not injection in the prostate itself.
Yes.
If the patient is incapable for surgery, we use what we call minimally invasive techniques, like transurethral needle ablation, like cryo, like stenting this part of the urethra. But we use it for the patient incapable for surgery, unfit for surgery.
So, by the end of this episode, I want you to give some advice to our audience how to avoid or at least delay the problems of the prostatic enlargement, and if they do have it, what should they do to avoid the major complications or problems out of it?
They should investigate early. People after age of 40 should do PSA early, maybe every 3 years above the age of 40, every 1 year above the age of 50. Investigation, routine investigations like ultrasound should be held every 2 years at least. Any symptoms, any irritative or obstructive symptoms, what we said, lower urinary tract symptoms, should be investigated. Recurrent urinary tract infection should be investigated.
And treated, of course.
So, don't delay the management of your prostate. It will harm all the urinary tract. As I said, some people came with complete renal failure. So be cautious with your prostate. Treat it early. It will live longer with you.
Dr. Muhammad, thank you very much for being with us today. It's been a very informative talk. Dear brothers and sisters, I would like to thank you, and I hope it's been a beneficial episode this time. We hope to hear from you, and until next episode, we wish you a happy and a healthy life, inshallah. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.
The value of money in the hereafter will be measured by its proper use in the present.
يا أيها الذين آمنوا أنفقوا مما رزقناكم من قبل أن يأتي يوم لا بيع فيه ولا خلة ولا شفاعة.
According to the glorious Quran, one of the best ways to use your money is to spend it in the way of Allah subhanahu wa ta'ala by spreading His message of Islam. Peace TV is a non-profit Islamic satellite television channel that is primarily dedicated for just that cause, the proper presentation of Islam. It's a great choice to invest in it and a golden opportunity to purify your wealth in a way that pleases Allah subhanahu wa ta'ala.
Support Peace TV. Send your zakat and donations to IRFI Al Ryan Bank, 47 Calthorpe Road, Birmingham, UK, B151TH. Pound account number 011-32301. IBAN GB49ARAY 30008301 132301. Sort code 300083. Swift BIC code ARAY GB22. Please confirm your contribution at support@peacetv.tv.
Support Peace TV, the solution for humanity.
Quran is the divine word of Allah. It is the final revelation to humanity. It is a means of healing, both spiritually and physically. Whosoever abides by it is guided. To ponder and reflect on its beautiful verses. Join me on Tafsir al-Quran al-Kareem.
Appreciate the significance of tafsir to realize the essence of the Quran in Tafsir of Quran. Every Sunday, Tuesday and Thursday at 11 p.m. and repeat telecast at 12:30 p.m. UK on Peace TV. Peace TV English, the solution for humanity.
Say
Allahu Akbar, Allahu Akbar. God is great. Allahu Akbar, Allahu Akbar. God is great. Allahu Akbar. God is great. Allahu Akbar. God is great.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. This is your host, Gabe Al-Romani, and welcome, brothers and sisters, to another episode. And if you're just joining us, we're discussing issues surrounding our communities, our 21st century ummah, living in a global village world, a lot of influences, a lot of changes. And we're trying to reach out to you to share some of our experiences and some of the advices directly from the Prophet ﷺ, from the Sahaba, on how to better ourselves as Muslims and how to use these points to better our ummah, inshallah, bidnillah, and to bring it back to the place that it was meant to be in, inshallah. To join me again today, Jazakumullah khair, my dear respected brothers and teachers, Sheikh Dr. Ahmed Ibn Saifuddin, Sheikh Salim Amri, and Sheikh Asim Al-Hakim. Assalamu alaikum wa rahmatullah.
Alaikum salam.
How are you?
Allahumma lak.
Alhamdulillah. Today we're going to talk about a very important problem. And I would say here that there's really no positives to this. It's quite a negative topic. And it is that of rumors, hearsay, spreading information without verifying things, backbiting, all these things that are so damaging to our ummah and our society. Let us start with the warnings that Islam, Allah subhanahu wa ta'ala, the Prophet ﷺ, gave us when it comes